If you have knee arthritis, you might have been offered to have a cortisone injection to help your knee pain. Or alternatively, you might have been told that a PRP injection is a more natural choice. Here's the thing. One of these injections will actually work quicker for you, give you more fast relief. The other one will actually last longer. Both of them can be the wrong choice if you use it for the wrong reason. So in this video today, I'm going to break this down and explain to you the pros and cons of each option in plain language. Okay, so we're going to explain what each of these injection actually means. What do they actually inject into your joints? The other thing we're going to talk about is how long does the relief last for? We're also going to talk about evidence. So what does the actual research say? What actually has been proven to be effective? Then I'm going to put it all together and explain and try and digest for you which of the two options actually works better in your particular case. I'm also going to talk about the question you should be asking before you let someone inject a medication into your knee joint. Hi guys, my name is Alex Blazewski. I'm a physiotherapist with over 22 years experience working with people with knee arthritis. So what is cortisone? Cortisone essentially is a steroid medication, steroid drug. It's a strong anti-inflammatory. In some cases, doctors prescribe it as a tablet, as an oral anti-inflammatory. In some cases, they inject it into your body, into your joints, into your tendons sometimes. So it's a fast pain relief, essentially. Think of it as a fast anti-inflammatory. PRP injection is pretty much the opposite. So PRP injection is more natural. So PRP injection is what they do is they take some blood from your body. They put it through a spinning machine, a centrifuge, and they essentially extract a platelet rich component of your blood. Then they take that and inject it into the affected joint. In this particular case, it will be your knee. So this platelet rich injection contains what we call growth factors. Okay, so it actually to a degree, it helps the healing response. Now, just to be clear, it does not grow you a new knee joint. Okay, so this will be science fiction. This is not true. However, there's some indication that it may help to improve your pain levels over a period of time, and it may help to calm things down a little bit. Now, let's talk about how long does it actually take to work. Okay, so as I mentioned before, cortisone injection or steroid injections, they are usually a lot quicker to kick in, to start working. Okay, so most people will feel some degree of effect within first 2 or 3 days. Okay, so you may expect some relief within that time frame. Now, for some people, it may take a little bit longer, but usually the effect of a cortisone injection peaks at about 5 to 7 days after the injection is done. Now, just one thing I need to note. So the first couple of days, sometimes the pain gets worse before it gets better, okay? And that's because they put the needles through the joint, and that can actually cause a bit of irritation. And that's why sometimes they'll actually mix your cortisone injection, the actual medication in the syringe, with a fast-acting sort of pain relief, okay? So to numb the area, and that actually makes it hurt less. It makes the procedure more comfortable. So initially, the first few hours, you may get pain relief just from that local anesthetic. It's the same as when you go to the dentist and they inject that local anesthetic around your tooth, into your gum. It gives you a bit of numbness and a bit of pain relief for a few hours, but that's very short term. So if you go and have a cortisone injection done, you may get very fast acting pain relief first few hours. Then some pain may return for the next couple of days, and then the steroid itself will kick in, and that's when you get the effect from the actual cortisone injection. And look, that may last for up to 3 months. So most people, the effect will wear off after about 12 weeks or 3 months. The effect will peak at around about a week, sometimes 10 days. Okay, so those are kind of general timeframes. They do vary from person to person. Now, with PRP injections, everything takes longer. Okay, so again, you may have a bit of irritation the first couple of days, so there may be a little bit of an increase in pain. Again, because they're putting injection into your joint, and that mechanical tissue damage can cause a bit of irritation. And so most of the time, if you do get pain relief from PRP injections, it will probably be not until about at least 2 weeks after the injection. So most people will get some form of relief between 2 to 6 weeks after the injection is done. And the effect will normally peak at about between 6 to 12 weeks after the injection is done. So as you can tell, we're talking more long-term effects from PRP injections. And in terms of how long can the effect last, so it could last between 6 to 12 months. Okay, so with PRP injections, if it does work, which I will talk about in a second, the relief is usually between 6 to 12 months. Now, really quickly, I've created something for you that you might be really interested in if you're suffering from knee pain. So I've created a pain during exercise flowchart. So everyone tells you should be exercising if you have knee pain, but when you start exercising, quite often it hurts more. So in this flowchart, in this pain guide, try to break down and explain when you're experiencing pain during exercise, when you should carry on, when you should be more cautious, and when you should stop immediately. If you'd like a copy of this pain during exercise flowchart guide, just comment pain guide below in the comment section and I'll send it over to you straight away. Now, what is the scientific evidence? What is the research? What does the actual research say? So with the cortisone injection, with steroid injections, there's very little doubt that most people will get substantial pain relief for a period of time. Okay, so that is pretty much a given that's been proven. Again, not everyone is the same. There's a certain percentage of people that even with cortisone injections, they will not get the same pain relief as somebody else. Okay, but most people will experience some noticeable reduction in pain levels for a period of time. Whereas the PRP injections, the evidence is a little bit more complex. So there has been a number of studies done, and some of them say that it does give you relief, and some others say that it doesn't. Okay, so there's a bit of a mixed bag. The research is inconclusive, and that's why a lot of the mainstream insurance providers, quite often they don't cover PRP injections because it's not considered to be proven for certain that it actually works. Okay, but I think given the last few years of research, there has been a few new studies that seem to lean towards saying that it actually does work, but the effect may not be as strong as cortisone injection, and it actually takes longer to work. Now let's talk about the downsides. What are the cons, the downsides of each of these two options? So with cortisone injections, first of all, you have to be careful if you are a diabetic, because it actually causes a short-term spike in your blood sugar levels. Now, that is definitely something you want to be discussing with your specialist or your doctor, and that needs to be taken into account. Now, the second thing that has been proven by research in the area of side effects from especially repetitive cortisone injections, is that it can actually speed up the destruction or the disintegration of the joint cartilage. So there's been a study done where they looked at a 2-year time frame. So for those people who have had repetitive cortisone injections roughly every 3 months for 2 years, and they found that their knee joints, particularly the cartilage inside the knee joints, it breaks down faster if you have these repetitive cortisone injections done over a period of time. And as I said before, the cortisone injections, even though the effect for most people is more noticeable and it's more noticeable faster, not everyone gets the same amount of relief. So even thinking about my patients who had cortisone injections done for their knees and hips, the majority do report significant pain relief, but not everyone. There are a few people who say, look, I have not actually had much of relief, unfortunately, so it's not a guarantee. And as with most injections, and this applies for both the cortisone injections and the PRP injections, with injections, you always get a small risk of infection, which again, you need to be discussing with your doctor or specialist. Now, let's talk about the downsides of the PRP injections. So number one is the cost, okay? Because most insurers will not cover PRP injections just because they have not been proven beyond reasonable doubt that they work. They don't usually cover. So you have to pay, essentially, you have to pay cash to get them done. And therefore, the cost sometimes can be prohibitive for some people. So the cost is the one downside of PRP injections. Now, the second downside is they're less predictable. So with cortisone injections, most people will get some degree of relief. With PRP injections, not so much. Some people may get some relief and others don't. So you may pay all that money and get nothing in return. The third downside of PRP injections is soreness in the site of the injection. So where they inject it into your knee, roughly in that area, you may get a bit of soreness for the next 2 or 3 days. But that would be very similar to what you can expect from a cortisone injection as well. So that would not be any different. And by the way, guys, if you are considering having either cortisone injection or PRP injection, I'd be interested to know which option you are currently leaning towards. So if you just comment in the comment section, either cortisone injection, PRP injection, or maybe another type of injection. Some people prefer the hyaluronic acid injection. So let me know what you are considering at the moment, and maybe that will be the topic of my next video. Now, I'm just going to try and put it into context a little bit for you. So you obviously, now you know roughly what each of these injection option entails. So the key point here is, you might be thinking, what is the right choice for me? So which one should I go for? Should I go for the cortisone injection? Should I go for PRP injection? Or should I not inject anything at all? Okay, so it really depends on your situation. So with cortisone injection, having a kind of a more quick response, you having a more faster pain relief. If you are in a situation where your knee joint is already, the arthritis in your knee joint is already quite severe, and maybe you're waiting for to get a knee replacement, but you're trying to buy time, because quite often the surgeon might say, look, you're too young to have a knee replacement, so you need to give it a couple more years. So if you're just trying to buy time and give yourself, improve your quality of life in the meantime while you're waiting for the knee replacement, then perhaps having a cortisone injection is a viable option, because it gives you relief, more predictable. You could, again, talk to your surgeon about this, but you could have it done at regular intervals. But the downside, yes, it may cause further degeneration quicker in your knee joint. But again, if you decided that you are going to have your knee replaced at some stage, it may not matter as much. So if you are looking for short-term relief, then cortisone injection may be a viable option. PRP injection is, yes, it is more natural. It may not have such bad side effects in terms of destroying your knee cartilage, but again, it's less predictable. However, it lasts longer. So if you are looking for a more kind of a longer term approach, then possibly a PRP injection is a better option. And sometimes it comes down to a personal preference. A lot of people like more natural sort of options. So a PRP, if you weigh it up between cortisone injection being a steroid drug and PRP injection, which essentially is your own blood that they process and they inject it back into your body, PRP injection wins in terms of being more natural. Okay, so if for you being more natural matters, then PRP injection is probably a winner there for you in that category. However, I just want to mention one very important factor as well. Whichever option you decide on or choose, I don't think you should just inject and use it as a replacement for more conservative or more traditional rehabilitation approach. So having an injection, especially cortisone injection, and not doing your strengthening exercises or using it as a replacement for your strengthening exercises, that would not be a good option, because even though it may give you relief for a few months, if you're not doing your strengthening exercises thinking that the pain has gone away, when the injection wears off, because your muscles become weaker, you may end up in a worse position than when you started. So use that time when the injection gives you relief from pain to exercise more effectively, because if you use it if you use relief from the injection as a window of opportunity to do exercises more effectively, build more strength around your joint, even when the injection wears off, you might be in a better position because your muscles are stronger and they're more capable of giving your joint more support, and therefore possibly your pain levels may actually be better. So that would be a wise approach of using these injections to give yourself some pain relief and strategically make yourself better long-term as well. Now, the one question in the beginning, I said you should ask your doctor or specialist before you let anyone inject anything into your knee joint. In my opinion, this would be what is right for your particular situation. Sometimes when you see a doctor or specialist, it's really quick. The appointments are so quick, you may not have enough time to ask all the questions. So you should make sure that you ask this one question. So tell them what your goals are. Are you looking for relief long-term, short-term? What do you think will happen in a couple of years or 5 years down the track? Have you accepted that you will eventually need to have a knee replacement? What is right for one person may not be right for another person. So everyone's situation is different, and you should really consider all these factors, discuss it with your doctor, and then decide on what is actually correct for you. Now, you might be interested in this video right here where I explain the 5 new alternatives to having a knee replacement that might be available sometime very soon.